This is Dr. David Pomeroy, your host on ADHD Focus. I wanted to remind you that the show is not intended to be a recommendation for diagnosis or treatment of any condition for any specific person. Please consult your mental health professional or doctor managing your ADHD or mental health issues about any diagnosis or treatment-related information that you hear on the show. Refer your ADHD provider to the show if he or she would like more information. So I'm glad you're here to join us today. My guest today is Cynthia Hammer, who is an amazing force in the ADHD world, getting the word out and educating people about ADHD in every way she can. And her latest project is Find the ADHD Girls, and that's what we're going to be talking about today. Cynthia, it's a pleasure to have you back on the program.
Thanks, David. Nice to be with you again.
So we're talking about finding girls with ADHD younger than when they're 50 or 35 or they're flunking out of college or whatever. And it's difficult to tell that a girl may have ADHD compared to many boys, though I think boys with inattentive ADHD may fall under the radar too. And I should back up here and remind folks that there are basically two variations of ADHD. One, the inattentive type, easily distracted, daydreaming, not really catching up to what's being said or what they're reading, forgets a lot of things, disorganized, loses things, and hyperactive, which may be moving a lot. And certainly in elementary school, it's easy to see the boys moving all over the place and jumping around. And girls are less likely to have the hyperactive type, though some traits of that show up differently in girls. We may get talking about that. So about half the people with ADHD have the inattentive type, and half have both of those types, so that's termed the combined type. And it's the inattentive type that gets missed most often, and I agree with a lot of the latest research and writings that more often it's in girls, though I think there's still a fair amount of inattentive ADHD in boys that gets missed.
Well, Dr. Pomeroy, if you remember, I interviewed 25 men, and you were one of them. 25 men that had inattentive ADHD, and I think all of them, I can't think of one that got diagnosed as a child. So it's not just an issue of girls going undiagnosed, but it's the inattentive type, because the public has such a strong image of what ADHD is like, and it's the hyperactive child.
So when I was growing up, it was called minimal brain dysfunction, and there was no idea of exactly what it all involved. And I was well into my medical practice before even the criteria came out for inattentive and hyperactive, and in the, what was that, this DSM-3 in 1993, I think. So the chances of my being diagnosed were pretty low, but I agree. I think the typical belief about ADHD is that it's the hyperactive, misbehaving, always moving, always talking person, and that's definitely not the case.
Yeah, so, and I'm wondering, sometimes I talk about it, it's almost like the reverse side of the coin, that you get this idea that it's the 78 RPM, but then you see this other version that's more like 33 RPM. You know, these are old images of old records, but I'm trying to convey the intensity and the energy of hyperactive, contrasting it with the slower, quieter, more introverted version that's still also ADHD. And where we think we don't feel it's hard to recognize. We feel that people haven't known what to look for.
Mm-hmm.
It takes more time to put
Mm-hmm.
together more clues, but we still think it can be identified.
Well, I think also the way it's manifest in girls is different, partly because I think they're more socially aware, so they're not going to want to stand out because they don't want to show that they're not paying attention. Ted Mandelkorn, one of the ADHD specialists up in this area in Seattle, who practiced for many, many years, retired just a few years ago. He had made a video, put together a video program about teenagers and ADHD, and in it he interviewed some girls, and he asked them, would the teacher be able to tell you weren't paying attention? And the girl said, well, no, I'm not stupid. I'm looking at her. So that's a perfect example of masking. I'm not going to let you know I'm daydreaming because I want to make sure you think I'm right there, and boys could care less.
Well, and I don't know, that's one reason we think early diagnosis is going to help, because the longer a girl is masking, we think the more adept she gets at it. So a teenager is really adept at masking, but a 7-year-old, which is where we want the diagnosis to happen, they've been masking maybe since 3 years old, but they're not very good at it yet. And so we can see through it.
Yeah, I'm not sure about how young whether it's masking.
There was a
it's not
psychiatrist that told
necessarily.
me that. She said an astute, smart 3-year-old can know what's socially acceptable. Yeah,
I think that's true. And boys lag at least a couple of years in emotional maturity behind girls, no matter what. Neurotypical, ADD, anything. But I think it's more important to girls. And so that's, looking at the teacher, that also turns into, I'm going to be perfect. I'm going to behave perfectly. And so I can't get criticized, and I'm going to get perfect grades, and all my work is going to be perfect so I don't get criticized. Maybe they're really sensitive to criticism. And so perfectionism, while one disadvantage, then at school they say, well, you've got good grades, you can't have ADHD. It's another one of those myths out there.
Well, it gets to be seen that ADHD just affects someone academically, and we know it affects every part of their life.
Oh, sure. Well, the thing and I've seen a number of girls in high school where they're bound and determined to get the homework done. And if they have to stay up till midnight, 1 a.m., they're going to get it done. And it's not necessarily because they're spending a lot of time on social media till 10 p.m. No, and some are, but many are not. They're studying till that late. Well, then they have to get up at 6 a.m. to get to school. So here they're sleep deprived, but they're studying all the time. One girl had 2 tutors during the week, her parents helping her every night, and she was up till midnight. So yes, she had good grades, but at the cost of any social interaction. She couldn't do after school clubs. She couldn't do any of those kinds of activities because she was so focused on, nope, I have to get good grades.
Well, some of the women I talked to that, got diagnosed late, they said that some of them that realized they were putting in more time to get their work done, even when they were employers, they were ashamed of that. They kept it hidden. They had subterfuge, a way to not let their coworkers know how much extra time they put in. And on the other hand, there were women who never realized that life was easier for other people.
Yes. And And there are probably some men in that, not realizing things could be easier. But I'm thinking of one woman, and she's known she's had ADD for at least 10 years, and she still brings work home and works from home. She said, I don't send any emails because I don't want people to know I'm working late. And that's exactly it.
Wow, that's a lot to be holding in your mind all at once. I mean, I was always telling my son, it's easier to be honest because then you don't have to think about the lies you told and to keep them going.
Yes. And so she's, keeping this image of she gets so much done, but she works 2 and 3 hours at night more than other people.
Yeah.
That definitely is a question I ask. And I think that many, good diagnosticians taking history and not just looking at rating scales are going to ask, do you think did it seem to take you longer than it does with other people? And I think at least one of the rating scales, one called ADHD-RS, which has a lot of sub-questions that kind of explain the language of the actual criteria that's in the DSM. So appearing to take have to do a lot more work, takes a lot longer to do the same amount of the homework. And that's one of those, I guess you could say, signs that parents might see. And we talked a little earlier before the show that the perfectionism that girls take on so that they can get good grades, parents may think, boy, great, you're getting super grades and you're doing everything perfectly. And that's not necessarily a good thing, because it also does lead to anxiety, as you pointed out.
Mm-hmm. Well, and I wanted to say the checklist we have at our website, it was developed for 7-year-old girls. And like the one you mentioned for adults, we actually take the criteria and say, what kind of behaviors might you see?
Excellent.
And so we just think that's more helpful. Even for myself as an adult, reading the criteria, it would say often, blah, blah. And I said, well, what's often?
Yes.
How do I get to judge what often is? So we say, if you see this behavior 3 times a week, then we think it's often, and check it off. And
some of I think a drawback of that ADHD-RS is their things are none, mild, moderate, and severe. Well, no one wants to be severe in something, so most people are moderate's okay. So I think that design part. I wanted to return to something you said, that what you had on the website, and that's the resource. Could you talk some about the resource library you have?
I'll do that, but before I forget my thought, I wanted to say
Please.
that's one reason we think teacher evaluations are so valuable, because they see enough children that they know what mild, moderate, significant, and where a parent might not,
point.
The person might not. You need someone who has seen a lot and could say, wow, this is off the charts, or no, this is similar to other children I'm seeing this age. So I think that's
a good point.
The input from teachers we really value, and we would encourage parents to be talking with the teachers to get the teacher's view of how the child's doing in school, combine that with the parents' observations of how the child's doing at home.
Yeah, definitely. And part of the criteria is looking at, is it different than other children at the same developmental stage, which isn't quite the same as the same age, because someone who's a late starter versus, and all that birthdays in September and who starts what time, but some kids they may be 9 months younger than their classmates. Well, at age 6, 7, 8, 9, that's a huge gap in maturity and brain development, emotional maturity. So that can play a role. But I do think that definitely the teacher's observation, because they have this, okay, here's a group of 26 kids. And boy, these two are just, this one they're never paying attention. They don't know what we're talking about when I ask a question. And some other kids may every once in a while not, but someone who's all the time doing that, that's the one, the teacher can see. So do you have...
I think even when you have two children that are exactly the same age, that doesn't mean they should still be at the same development.
Oh, no, stage. No, not at all. Not at all.
You know, it's a starting point, but it's not that firm that you need to be at this milestone at this age.
Yeah, no, there's a wide range in the milestones there. So are there resources for teachers on the Find the ADHD Girls website?
We're creating bundles of handouts that would be good for teachers.
Great.
They'll be available in our store, but we do have information now that teachers could easily come. It's all categorized, so they would just have to be exploring the category that seems like where they want to get educated. In our repository, people go there. It's organized by categories, and then under each category, we offer handouts, articles, interviews, and infographics.
Great.
And I don't know, people that have been going to look at it, they're when they discover it, they're happy, and they're telling us that I can really use this in my practice. I can really use this with my families. So our stumbling block is to get people to just go look at it, because it's like once they see it and understand what it's offering them for free, we don't have any problem. Yeah,
and that's that findtheadhdgirls.org.
Yeah. The repository. On the home page is the checklist, and then there's the repository. Those are the two, I'd say, big features on our website. And also now in our store, we're having a store, we've created digital products that are really unique to a young girl with ADHD. One of them is called the affirmation calendar, and it's just the calendar for the year, but every month has a different affirmation on it. And at the back, we have all these stickers that the girl can cut out and embellish her calendar herself with her stickers. And then we've created greeting cards that parents or grandparents could email or print out and mail to their granddaughter to say how proud they are of her, how they enjoy her different personality, her different insights, expressing how she's unique and they value her. And we have all those greeting cards. They can choose which one they want to put.
Oh, that's great.
And the last thing we have is we're always making more things, but now we have a series of posters, affirmation posters, and if a parent wants them print them out at home, they can do it on 11 by 8.5 by 11, but if they want to take it to Office Depot and get big posters printed, they could too, to put up on the wall. And we have probably 12 different posters, and some of them are organized into sets. So if parents wanted to buy a set of six matching ones that are all affirmations about the girl saying, I have a unique brain and I learn in a special way, things to highlight her room, those are available in our online store.
And that's great. And it sounds like those things don't specify, and your ADHD brain does that, because that's kind of a label, but just saying you're unique, and yes, your brain can do different things, and I've never seen that. Yeah, I've not seen a study as to whether neurotypical people also have this particular kind of thinking pattern, which I've heard called associational thinking, where one idea triggers another one. Well, the second and third ones could be from 10 years ago, and the other one's associated with a strange word that you heard on a podcast 6 months ago, and you string these ideas together, and that's ADHD.
I think we could say that they don't, David, because if you've ever been on a Reddit where they are back in, Reddit's for people with ADD, they're back and forth, this idea pinging off of that idea, and full of energy, full of creativity and humor. And at the end, someone was saying that was fun.
Yeah. Now,
I don't think neurotypical people would be spending their time like that.
Probably not. And at the ADHD conference, the international conference that was in Kansas City most recently, Anaheim the year before, conversations between two or, of course, three people with ADHD are similar. Someone with ADHD is not going to be able to follow it because it's bouncing all over the place. And all three of us in the conversation think it's great because all these different ideas and we're spinning off one thing and another. So,
well, and the other thing is that our way of communicating works well for us, but other people would think of it as rudeness.
Yeah, could be. Well, I want to move on to one of the other questions you had posed to me in terms of my observations and thoughts about diagnosing children at age 7 versus 12 to 13 or later. And I think one of the places where ADHD behaviors and traits can show up and really get the strain that makes them show up are transition times. And when there are, and it's not just, for instance, elementary school to middle school. Now you have 5 teachers and homework's due at different times and has to be turned in different ways, usually online something, but a lot more to keep track of, and you're moving around. Yes, it gets more complicated, and that stresses the executive functions. And some people can do great all the way up through even, and a number of doctors have ADHD, myself included. Number of emergency room doctors do, and maybe a higher percentage than certainly in the general population, because it's fast moving, it's intense, it's easy to focus when the pressure's on. But documentation of all that stuff is really difficult in an emergency room or anywhere else. Emergency room is one of the only places where they have a lot of checklists for their signs, symptoms, diagnosis, because that's the hard part. That's the arranging meetings. Okay, now you're the lead or the manager, whether it's in IT or any
so you're saying as life gets more complicated, it might show up more, but our organization is not wanting us to wait till that.
I know that, but that's the point, because someone who's pretty intelligent, elementary school was relatively easy, even without the perfectionism stuff. They can do that. And parents and teachers are their executive function. You get a reminder of the teacher. Don't forget you have homework to do. Don't forget this is where the homework is due. And Johnny, you forgot your glove. Someone picked it up. So the losing things and the spacing out, and teachers are more inclined to be willing to help that person get more in tune and pay attention. Whereas in middle school, at least what I'm told, is there's the expectation, well, you're old enough to do this yourself. And the teacher isn't going to have those reminders.
So the expectations kind of change. And
the expectations.
Dr. Orrin Mason says something that I wonder how you think. He said that teachers might look over the classroom at the beginning of the school year and kind of tell themselves, oh, that child's going to have difficulty, or this child is going to need help. And at that point, the girls with ADHD are getting overlooked because in a new situation, they can look really good.
Yep.
And so he's advising teachers to go back after 2 or 3 months of the school and then be looking for the girls who they are saying
Something's
she's looking
different.
out the window too often, she's dreamy, she's turning in her paper with not half the problems not solved, she's not aware of where we are in the class on the lesson. Yeah. So
yeah, definitely. And the teacher expectation, and it's going to play a role here as well as just in general. There was a fascinating study where teachers were told with one, and I don't know, it was the same teacher or group of teachers were told, boy, this class is really tough. It's going to take a lot of work. They really aren't really good achievers. And another one, man, these kids are so sharp. They're just right on it. And actually it was reversed. And the kids who really were ones that they weren't sharp, they were the ones they did great. And the others didn't do so well. The expectation is kind of teach to the expectation instead of challenging. Kind of think, well, they aren't going to be able to do very well and not have that high bar. So that's something that teachers need to be aware of. But I agree with Oren. I think it's a great idea to go back and rethink kind of whether it's after 2 months, you get to Halloween or after Halloween, then start thinking.
And then you might attribute it to too much candy. So
yeah, I was going to say, wait a week after Halloween. But when you get thinking about Thanksgiving's coming, then
well, and I have another thing I learned from a guy in England. He's trying to help teachers, and there the teachers are allowed to express their concerns. But he was saying to take the onus off the teachers, he just wants them to think of children being on a bell curve. And the ones they need to bring to someone else's attention are the ones that are falling off the bell curve. And that sounded like a simple way to approach it.
Yep. Yeah, because that concept of the bell curve is pretty well known and easy for people to see. Now and we've kind of talked about this next one a little bit just in what we were talking about here is the environment increasing or decreasing the challenges. And that's exactly, there are definitely a lot more challenges when you go to middle school or from high school. Now there's even less scaffolding of parents around than in college, where the prof isn't going to come to you and say, gee, it seems like you're having trouble. You need to go there and ask for help. And I think that's one of the key things all the way along, in high school or anywhere else. If you can't figure it out, ask for help. That's what the teacher's there for.
Right. That's true. But I think even when people know, they are reluctant to ask for help because of shame.
Yes.
They
I think that holds true.
They don't feel they warrant help, or that, it's a false belief, but that it's unfair for them to get help.
Well, I think that it's more, I shouldn't need it. I shouldn't need help. Other people aren't asking the teacher. Other people can do it. And therefore I should be able to do it without help. And, that's just not true.
I suffered from that. I don't know what the syndrome would be, but I wasn't able to keep house, and I was home all the time. And so I resisted having someone come clean the house because I should be able to do it. And then when we finally hired someone, it frees you up you stop being so judgmental about it. You just say, this is great. I'm able to do other things. I was, making myself feel terrible, and now I don't have to feel terrible about that.
Yeah, though, did you find that you could it took you a while to find things because this person had a different idea than you did about where they should go. That happened in my family when my mother went back to work after I was, I think, 8 or 9, and so they hired someone to come in. She'd come in once a week. Well, the night before, my mother would be scurrying around cleaning up, and I said, "Isn't that what this person's supposed to be doing, cleaning up?" And it's, "Oh, well, I don't want her to see how much of a mess it is." Okay. And then for 2 days after she was there, this woman was a darling Scottish woman, Mrs. Nichols, and my parents would say, "I've been Nichols again," and trying to find something that she'd put away somewhere else. But I think it's definitely,
but I think
being able to acknowledge.
The point you bring up too is that is why a lot of women, some of them start to recognize when they start what the premenstrual or what do you call it?
Perimenopausal.
Okay, that. But also they were noticing when during COVID and they were home with the children and they didn't have the structure of work and that was a big time. And that's why a lot of women were getting diagnosed during that era. And now I think they continue to get diagnosed because there's a lot more information out about women with ADHD.
And I think also with the COVID that parents were then observing their children in school, which of course they didn't, do all the time, and realizing you aren't keeping up with what we talked about 10 minutes ago. What are you doing this? And as long as
they could see that one child got the work done in 10 minutes and another child was working 3 hours back and forth.
Unfortunately, how come you aren't like your sister? She's getting everything done. Well, then you get shame going on. But still, that made it easier to see that. And at the same time, then parents were seeing, boy, this kind of reminds me of me in elementary school. And I'll see, I can remember more than once when mom and dad would bring their child in. We're going to look and see if they have ADD. And I'd say, this often runs in families. Is there anybody that, this sounds like might be in the family? And mother and son would both go like that over to dad. And he'd say, well, yeah, I guess that does kind of remind me of me in elementary school.
That's one thing that our organization has a couple of principles, and one of them is, getting diagnosed before age 8. But the other is, if anyone in the family is diagnosed, everyone in the family should get screened.
Yes, and that's definitely true.
If the parent has ADHD and doesn't know it, they're not going to be the parent they could be.
Yes. And particularly important with mothers. And there was one study showing that mothers with ADHD, even if their child did not have it, that child didn't do as well socially, in school, anywhere else, as a child without ADD and mother did not have it. So mother's ADHD impacted the child without ADD.
Oh, I can see how that would happen if the mother is bringing the child late to events, if the mother's not able to get the uniform done in time.
And turn in all the paperwork so they can go to
school. There's a lot of areas where the child gets judged on the mother's behaviors.
Mm-hmm. Yep, absolutely. You brought up something else in what we talked about initially as we were kind of looking at what we could talk about, is that the other thing going on in the transition to middle school, and particularly as they go through middle school, is the hormonal changes, which are definitely more dramatic for girls, and gets into the whole aspect of the fact that there's a cycle of the hormones, and in the latter part of the cycle, particularly the last week, then estrogen levels go down. Well, estrogen helps dopamine work better. And
Right, yeah.
dopamine is the thing that helps connect
Yeah,
stuff.
there's some women that are looking into this now, and I think it's filtering down that you increase your medication during that time.
Yep. And this gets into one pet peeve of mine, which is maybe the slight bump in medication during that week then puts somebody above the artificial FDA approved limit, and their insurance says, oh no, you can't have that many, which is mind boggling. When they're talking about some limit that's related to a medication that was approved in 1995, and there's a lot of research since that no, it's safe and effective to go higher than that. But the FDA approval part, they don't approve the medication and the dosing. They just approve what the company has submitted on the studies. And unless the company submits another whole bunch of studies, there's not going to be something that's an FDA approved.
So the doctor is allowed to prescribe whatever he feels appropriate, but the insurance might not cover what the doctor says is right.
Because they stand behind this FDA approval thing. And it is possible if there have been published studies that show that higher doses are safe and effective, then the insurance company, once you provide them, which means the doctor has to go out and look for them and know that they're there, then oftentimes they'll give permission to that. But that takes a lot more, whether it's the doctor or their staff, finding the articles, responding to this denial with a letter and a whole bunch of things about why one thing and another, simply because the insurance company says you can't have more than 2 pills a day. But I can go off on that subject for way too long. But I think that definitely the hormones play a role, both in terms of the cycle and things like that. But it must be a difficult thing for a girl to all of a sudden come to grips with that. My body's changing. I don't have any control over it. I don't necessarily like it, but I have to deal with it, and being anxious and or depressed. And she knows that for this week, she's just a grump and really grouchy and has a headache all the time. And that's got to be really tough. Then that, I would expect, triggers into a lot of shame. I'm different, one thing or another.
Yeah, I don't think it's a universal experience for women, because I don't remember having those difficulties, but I think they're finding it's more common than previously thought. Yeah,
and of course, any men can speculate all kinds of things. We haven't the slightest idea what we're talking about. So, and that's one reason I'm very happy that there are women like Lottie Skoglund in Sweden, who's an MD, PhD researcher in women and ADHD and hormonal fluctuations. That's her whole work. So that kind of emphasis with good, solid scientific backing and studies, it's wonderful to see that it's there. So what are some of the other things that we may not have covered as far as how it may show up differently for girls? And as I'm saying that, I'm thinking that depression and anxiety is much more certainly visible, I think, in girls and women. Men don't talk about it or mask that. So that, would it be fair to say that if a girl's showing signs of impairing anxiety or not wanting to go to school because she's ashamed of not having homework, one thing or another, that's going to show up more girls doing that than boys? And that it may be a flag to parents?
I don't know. We don't have the research to show that, and I'm reluctant to say that without a lot of knowledge. I was just surprised when I interviewed the men with inattentive ADHD, and I went through a lot of the other things that exist that Ellen Littman said she found in women with ADHD, that the men responded to that list too. You know, they responded that they had anxiety. They responded that they had depression. So I think it goes a lot with the undiagnosed condition.
Yeah, that's true. I don't think of very many males in my practice, number one, who come in and they're already on an SSRI for depression or anxiety. Some are, but many more women who have been, this one didn't work, this one didn't work. And, oh, well, it really turns out you've got ADHD underlying this. And after we get their medications sorted out, and pretty soon they'll say, I don't need that anxiety stuff anymore. Well, the anxiety was because of the impairments of the ADHD. Now there are, I think it's about 35 to 40% of people with ADHD also have generalized anxiety disorder, formal diagnosis, meet criteria. But a lot of people are anxious. They don't have generalized anxiety disorder.
Right.
But they're still being treated for it. You treat the ADHD and the anxiety.
I wrote an article about why ADHD is harder to diagnose, and it's because practitioners are more comfortable diagnosing anxiety. So if they see that, they might jump on that diagnosis and not go any further.
Yeah.
So if you present with anxiety or you present with depression, they might stop looking. So that's the problem.
Sure. And
that.
Of course,
again, we don't think that would be an issue with young girls, that they are not that much into those co-occurring conditions yet because they haven't suffered too much from a life with undiagnosed ADHD.
And the woman who's now 30, 35, 40, who's been diagnosed with anxious, she doesn't know she has ADHD yet. So she doesn't know it comes from that. So she's going to present with, I'm anxious about this. I don't want people to come over because I'm anxious. They're going to see my house a mess. So it's those background clues that, a lot of physicians don't know about ADHD, certainly to any.
Well, and that's the point you get at, David, is that when any kind of assessment, even with a young girl, it's not just the rating scales. It's the discussion.
No.
It's the discussion and the understanding of how they get through their day, what it's like.
Oh, absolutely. Absolutely.
Yeah.
Yeah. Diagnosis cannot be on rating scales. And, it sounds like you're daydreaming a lot and you've lost a bunch of things. Yeah, you probably have ADD. Absolutely not. There has to be as much or more history taking and talking to parents and talking to the child, and certainly beyond age 12 or 13, ideally time talking with the child without parents and vice versa, and then together. And I try to emphasize to the child, it's easy to see you're here probably because people are seeing how you didn't fit in. That's not bad. It doesn't mean you're a bad person. It's just fact that's there. So let's try to figure out what it is and help you be able to maybe cope with things better and life's a little bit less stressful.
Today, there's a woman I got to know that she was told to sit down she grew up, putting a straitjacket on herself. And now she has 2 daughters of her own, and she is bound and determined that they won't have that straitjacket on them.
Mm-hmm.
And it's wonderful to see how she's encouraging those girls to be themselves.
Yes, yes. And I have a number of women in my practice that look and see, oh, I don't want my daughter to go through what I did. And whether their daughter may not be identified yet, but now they're thinking, I bet she does. Or the teacher brought up some concerns about their daughter, and then as they looked into it more, they thought, this sounds a lot like me when I was younger. And then that aha moment and all the emotions that go along with that. So I think that's
and the other
great.
thing we're told sometimes the doctor might say, let's wait and see. Let's wait and see. And so we're out there saying, no waiting.
No waiting. Let's see if you flunk and see if you really need help.
Yeah. As soon as you're confident, move forward.
Yeah. No, and of course, with girls, let's wait and see means let's see if she gets really good at masking, then we don't have to worry about it because it won't show up. And the girl's thinking, okay, I'll really make sure no one can say there's something.
The problem for us disappeared, but the problem for her got worse.
No. But I think looking at the masking and perfectionism, okay, I'm just going to have to work harder so people don't think there's something wrong with me. And helping everybody, not just the people with ADHD, kids in it, but in general, different isn't wrong. Just because your brain works differently doesn't mean it's wrong. It may be defined that way by the 90% of people who think their brains are fine. Their brains are different some other way.
Well, I've gone through a personal journey like that, and I think the knowledge of ADHD is changing in that direction. But when I first got diagnosed, I just was so ashamed, and I thought I had a big letter. It spelled ADD on my forehead. Everyone could see. It just felt really like a lot of stigma and something to be ashamed of. And now the talk, I think it started more with the autistic community, is standing up and saying we're not defective, we're not wrong, we're just different. And that is so healthy, and that I have switched my thinking to believe that as well.
Yeah, I think unfortunately, and maybe now it's better known, and boy, if they could revise this in the DSM, instead of saying it's an attention deficit disorder, it's an attention difference disorder. There's no deficit of attention. People with ADD can pay attention great.
Right.
If they're interested, and it's less uncomfortable than what they don't want to pay attention to.
When Dr. Hallowell first came out with VAST, I didn't, but the more I think about it, it kind of describes us, the variable attention stimulus trait.
Yep.
Depends on what the stimulus is whether we get interested or not. And when we get interested, we get very interested.
Yes. And
so like
the exclusion of time or anything else.
Yeah.
Yeah, which can be, as one patient of mine said, or more than a couple of them have said, yeah, it all depends on what I'm focused on. I get hyper-focused, and if I'm doing taxes and I get that done, great. If I'm hyper-focused on getting to another level in the video game, that's not so good. If I'm hyper-focused on making sure the cuts on this furniture I'm building are exactly precise, and then my wife at 8 p.m. wonders when I'm coming into dinner, because I've been there since 1 in the afternoon and I'm just totally in it, and time dissolves when you're doing that.
Right.
Jeff Copper has kind of a flip side of the coin on that, saying, well, people with ADHD, yes, you're going to something that's interesting, but mainly because you're getting away from something that's uncomfortable. being bored, sitting in one place, that's uncomfortable.
Right.
Getting up and
That's
doing
true.
and being active, that's...
But I think we're drawn to things where we hyper-focus because it feels so good.
Oh, yeah, because we're either good at it or like video games and online things and TikTok and YouTube shorts that get you scrolling. They're designed to hold your attention. They're new, different. There's a variation, and that grabs our attention. I'm sure it does people with ADHD, but we're more susceptible, for sure.
Yeah.
And this kind of comes around, and I don't know whether girls spend more time in social media in terms of Facebook or I don't know how Instagram.
I hope they don't, because
17.
you realize that a lot of people put up a false image and then people feel less than because they don't have that.
Yeah, and there's that whole mocking. I mean, I don't know of any adult who wants to go back to middle school being 12 to 16 or 13 to 17, whatever. And I think a lot of it because there is the in-group and the out-group and all this shaming and criticizing, and that's even worse with social media.
I wonder if that could be because I have a friend from high school who doesn't have ADHD, and for her, she longs for her days back in high school. And I'm wondering if for those of us that are neurodivergent, if that would be a criteria. Did you enjoy high school? And if they said no,
that's a screening question.
That's it.
Okay, I'm adding that to my screening questions for histories, because that's kind of looking at then later in life someone who's 50, 55 to try to tease apart, is this really ADHD? Is what else may be going on? And as Dr. David Goodman says, it's diagnostic vigilance. The doctor's got to be looking to see all these other things. Of course, that would help if it was diagnostic vigilance at age 7 and trying to, the background of they're anxious all at what's causing that, one thing and another. But looking to find, was it that way when you were younger? And so that's an excellent question. Would you want to go back and be 14 again? And if not, why not?
And maybe this is tied in. I don't know if ADD could be as easily identified, but someone, again on Reddit, kind of tongue-in-cheek saying, I don't know why it's so difficult to diagnose autism. My classmates could tell in 15 minutes. Yeah,
it takes one to know one, or it takes someone who knows enough to be able to see this kid's different.
Kids can tell when something is off.
Oh yeah. So maybe the other thing, the teacher hands out something anonymous so kids don't put their names on it. Who stands out as different in this classroom? And if the majority of kids, nobody wants to hang out with that weirdo. And, people talk about, I don't want my child labeled, so we don't want to identify him with ADD. Okay, you can have the label of that kid no one wants to play with, or the druggie, or the high school dropout. But the kid nobody wants to play with because they're too in your face or they're loud, whatever. That's definitely another part of ADHD for a lot of kids.
Yes.
And a lot of adults don't have many close friends.
I don't think of that as the girls that tend to be hyperactive, they can be more aggressive, they can be more talkative, they can be more in people's faces. But the ones that are inattentive, they're more shy, they're unwilling to enter a group. They don't have the social skills. They don't have the comfort level.
Yeah, that's different. And they're going to be labeled as the shy or the loner or she doesn't want to get to know people.
Sometimes they do enjoy isolated activities. Some of them said, I love reading. I loved playing with my dolls at home. Not to rule that out, but I think that all of us have a drive for social connection.
And this gets back to all the environment. Well, as usual, the time goes by too fast. We need to stop our conversation, which I'm sure we can continue another time. Folks, my guest today has been Cynthia Hammer, who is a champion now for finding the girls with ADHD and helping identify girls who have inattentive ADHD who can get overlooked when they're 7, 8, and 9, and then they get into a lot more problems just than what the ADHD itself causes. So thank you for joining us, and look forward to being able to give you a great show on our next episodes. Take care.